there, I'm Nicole Veltri and I'm interviewing as a physical therapist at Cayuga Medical Center's Sports Medicine and Physical Therapy in Ithaca, New York.
My name is Ghidotti and I will be interviewing Nicole during this interviewing process, and I am employed at Cayuga Med.
Hi, Ms. Ghidotti.
Hi.
Nicole Veltri.
Nice to meet you. Excited for the interview today?
Yes, thank you for meeting with me.
No worries. Okay, let's get started.
Great, and I brought my resume just for your reference.
Okay, perfect. So how are you doing today? Enjoying the weather?
I am. It's a little snowy outside, but we made it in.
Yeah.
We made it work.
Where are you from?
I'm from Westchester County originally.
Not too far.
Not too far. It's much colder up here in Ithaca than it is down there, but
Yeah.
just the same amount of snow.
I bet. So tell me a little bit about yourself. Where did you graduate? Your interests?
I actually graduated from Ithaca College, so I'm from the area. I graduated in 2020 with my DPT, and I've always been interested in physical therapy. I tore an ACL when I was in 8th grade, and that kind of set me up to following my passion and doing this. So I'm so excited to be doing the interview process now and taking a step towards hopefully working for you guys.
Awesome. That sounds great. So in regards to sports and orthopedics, have you had any prior experience with that?
Yes. So I always say my first taste of experience was myself. I've been in PT on and off since I was 13.
Okay.
I've had a couple of other ACL surgeries. So I really developed a sense of empathy and passion for athletes who have been injured, got their passion taken away from them,
Okay.
and I'm really interested in helping them get back to that. While I've been working here at Ithaca College, I have worked at the fitness center as a manager. I taught group exercise classes, so I'm very fitness oriented, and I'm currently working as a club sports performance specialist right on campus. So what we do is we put together workshops specifically for club sports, the injuries that these teams get, and we teach them prevention strategies, strengthening in order to help them decrease their risk of injury. So that's
Awesome.
Very directly applicable to
Yeah, of
working
course
in the
that
sports
is. Yeah,
setting.
that sounds great, especially getting involved in your college community. That's
Yes.
always awesome.
It's been a great experience.
So that just told me a lot about your strengths. So in regards to your weaknesses, do you have any kind of fears or tendencies that you kind of feel like you need to work on a little bit as you kind of move into the professional world?
I think that one of my weaknesses would probably be that I have not played a ton of sports myself.
Mm-hmm.
I've always been a runner. I played soccer when I was growing up, but, I had 2 left feet, so I didn't really try out as many different sports as I had liked.
Okay.
So, well, that might put me at a disadvantage for knowing what exactly goes into which sport each patient was playing and got injured. I have learned from working as a club sports specialist that if I take a moment, just watch a video of anyone playing the sport, so basketball, for example. I knew nothing about basketball.
Yeah.
I watched them practice, and since we as physical therapists are movement experts, I was able to look and break down the different movements that these athletes do constantly and figure out, oh, this is where the stresses are, this is what could cause this type of injury, and really break it down in that regard. So, although I don't know how the scoring works in basketball, I know how the body works in basketball. So
Awesome.
I've learned a lot from that experience, which can help me with this job.
Awesome. I think that is wonderful because sometimes not only you can identify your weakness, but you can understand it. And I feel like you do understand
Thank
your
you so
weakness.
much.
Yeah, that's great to hear. So what interests do you have about this job, specifically in Ithaca, New York, and working for Cayuga Med?
Well, as an IC grad, Cayuga Med is the ultimate place to work. So I've wanted to work on your team since I was a freshman, since I even heard about it. I just think that the way that Cayuga Med spans all across the area helps so many different types of people. Over at Island Health and Fitness, for example, you guys have a gym, you have a PT area, you have aquatics. So right in that one building, you're reaching so many people and impacting so many lives right there. What about the hospital? What about your other offices? All together, you guys are helping so many people, and I would love to be part of that.
Yeah, that sounds amazing. So you kind of talked a little bit about what experiences you had to prep for this job through college. Have you had any experience after graduation that could have prepared you for this job, specifically in orthopedics?
Yes. So since I graduated, I've been studying for the boards, of course,
Mm-hmm.
but I've also been studying for my CSCS,
Okay.
and I'm planning on taking that exam in January.
Okay. Sounds good.
So I've got that under my belt as well. And I'm additionally certified as an emergency medical responder for
Okay.
athletes.
Oh,
I got that certification in 2019.
Okay.
Yeah.
Awesome. That sounds great. So if you were to get this position and looking towards the future, where do you see yourself in like a 3 to 5 year span? Not only in the PT world, but personal self. You know, here at Cayuga Med, we like to understand all of our employees and where they are personally to help them grow as individuals.
That is so nice. Well, with regard to physical therapy, in 3 to 5 years, I would love to have gained even more knowledge than what I have now. Build on what I know, look at things in different perspectives than I have as just being a post-grad. Hopefully being part of a mentorship program that I know you at Cayuga Med really focus on. I would also like to start pursuing some of my own passions, which is ACL prevention.
Mm-hmm.
I'd like to figure out a way to integrate prevention with physical therapy. It's not covered by insurance, so that's kind of an obstacle, but working with you and your team to set that in motion and really change lives of these young female athletes. With regard to personal, I would love to have myself a house, have myself a husband, and, have a nice little life starting out. We shall see.
Yeah, that sounds amazing. And from your resume and just having a conversation with you today, it seems like you're very motivated personally and academically and professionally. So you seem like you would be a great asset to our team. Just to conclude, do you have any other questions for us as a team or me personally?
I just wanted to know what your metrics are for measuring success of the clinic, of each individual, and of me personally as the therapist.
So like I said, we typically not only look at our employees as from their professional standpoint, but personal standpoint as well. And we really take a value on our employees that come in motivated every day, ready to work, and we do like to see patient feedback. So we do look at all of our therapists in the clinic and how the patients have feedback, because we really do take it seriously. Maybe at the end of every month we go and look at all the patient feedback forms and really hone into some of the therapists' strengths and weaknesses. So if you like that idea, and we always take feedback from our therapists as well to see what they like and don't like about how our program is running. And in regards to that, yeah, we really try to work as a team.
That's excellent. I am all about feedback. I love to know what I'm doing well and what I need to improve on, because I'm trying to be the best I can be. So I like that you guys do that type of feedback.
Awesome.
Another thing I had a question about is what your goals are for each individual working in our office. So for me as a therapist, for you as the HR manager, for the head therapist, for the front desk, what are your expectations for everybody and how we work as individuals and as a team?
So as a team, we all have meetings every single week, every month. Every Thursday we actually meet at the lunch hour to kind of debrief everything that's been going on every week. And it's awesome because the front staff, they're in their own kind of mojo going throughout the week, really understanding what's going on up there. They come up to the front and talk to all of us therapists about where they are with scheduling, billing, insurance, any changes that the insurance companies might talk to, because it really helps us then be able to talk to the patients if they have questions. We always want to create a clinic that no matter who you're asking, everybody knows the same answer, which can be beneficial to the patient and not confuse the patient at all. So just like the front desk people will come up and kind of debrief about what's going on in their job, the therapists do the same. Even though the front desk may not know anything about shoulder rehabilitation, we still talk to them about it. And another thing that we really do pride ourselves at Cayuga Med is the follow-up. We always really want to make sure, well, actually in the beginning and the follow-up, that the families are always included, making sure that they feel comfortable and they're always prepared with information and they're always given the right information in regards to the medical and the billing and the payment, so everybody again is on the same page.
Excellent. That's great, because that works really well for the patient, but then it also allows us to interact more with the front desk, keep a nice good relationship with that, and everyone's equal. I really like that.
Yeah, well, it was great talking to you.
Yes, it was.
I look forward to meeting with you again.
Thank you so much.
And you'll hear a follow-back call and email from us.
Great.
Yeah, and if you have any questions, feel free to contact me. I can give you my number.
Oh, perfect.
There's my number.
Oh, thank you so much.
You're welcome.
And you have mine right on your resume.
Yep. Thank you so much.
Thank you. Nice meeting you.
Hi, my name is Corey Ghidotti, and I will be interviewing today at Mary Free Bed Children's Rehabilitation Hospital in Grand Rapids, Michigan.
Hi, and I'm Nicole Veltri, the physical therapist who will be interviewing Corey today. Hi, Corey.
Hi.
Nice to meet you.
Nice to
Welcome.
meet you. Thank you so much.
How was your ride in?
It wasn't too bad. The flight wasn't that bad.
Oh,
Yeah.
good. Where are you flying from?
Ithaca, New York, actually.
Ithaca. It's cold there, too.
Yeah, it is really cold. Yeah, so do you have a copy of my resume, I think, just before we get started?
You gave it to me in the
Awesome.
email. It was perfect.
Okay, great. Good to know. But yeah, so I graduated from Ithaca College, and I ended up staying out there for about a year or so because it was just easy transition. I'm actually originally from Massachusetts.
Oh, really?
Yeah,
Where about?
The Berkshires.
Oh, very nice.
So
I've gone camping there.
Oh, nice. Western Massachusetts. Yeah. So been out in Ithaca for a little bit, but I took this job. I've been to Michigan a few times. Both my parents went to U Michigan. Go Wolverines. It's been
My alma mater.
Blue at heart. Yeah. So I've been there for quite some time. Every time they went back for reunions, I would go back and hang out with them, see the campus. So I just fell in love with the area. And there's so much to do, not just for professional reasons, but camping, hiking, biking. There's so much to do.
That's great. You love all that stuff.
Yeah.
Our team, sometimes we have outings where we go and do those activities together. We're all outdoors.
Oh, cool.
So you're in the right place.
That's nice to hear.
So tell me why you're here interviewing at Mary Free Bed.
So I've heard great things about your program. I love, just from the research that I've done alone, the hours seem great and flexible. You seem to really work as a team and have that whole kind of unity between everyone, between the front desk staff to the cleaning of staff to the PT aides, from the OTs and speech path. I love how you all kind of have all those professions in just one area. So it's easy communication, which I really take pride in, because from all the schooling that we've done, we always learn how important it is to have good communication between all the professions, especially now when we're dealing with children. You know, it's important to get everybody on the same page between all professions.
You're right. We really do pride ourselves in taking a holistic approach to treating these children all across the board and ensuring that they're getting the best quality care from everyone who's working with them. So it's great that you prioritize
Thank
that.
you.
Tell me a little bit about what got you into pediatric physical therapy and why you are great at this job.
To be honest with you, I had no idea I wanted to do peds. I was really interested in women's health, thinking that was what I was going to do the rest of my life. My first clinical, I was fortunate enough to have it at home in the Berkshires, in Berkshire Medical Center. And it was an outpatient clinic, very small, but my CI was actually an orthopedic specialist, but I was fortunate enough to be able to see a pediatric therapist as well and shadow her, and I just fell in love with what she had to do. We saw everybody from cerebral palsy, muscular dystrophy, and torticollis, and just being able to help not only the infant or 7-year-old or 13-year-old, we helped the family. We took away the worries and the fears that they had for their child, and we also not only help the child put a smile on their face, but the families as well. And after that clinical, throughout my schooling, I was able to get my other peds clinic, for my clinical education number 4, I went to California and was able to spend 12 weeks working solely pediatrics, and not only the California beautiful weather, but that just made me fall more in love with being able to treat pediatrics. Yeah.
It's so nice and rewarding to see the smile on those kiddos' faces and actually see them progressing. We're changing their lives, which is just so rewarding.
It is very rewarding.
Excellent. So it seems like you've had a lot of clinical experience with that, which is phenomenal for this job. Tell me a little bit about any weaknesses you might have coming into this job, anything that we might have to work on and build up with you.
Sometimes some of my weaknesses, I feel as though, not only because I don't have children of my own, I don't come from a big family with young children, so I feel that sometimes even though medically and professionally and through academics I'm able to diagnose them properly, sometimes I feel maybe communicating with the peds patient, sometimes we have such education for so long, it's easy to rattle off all these crazy terms and crazy language to them, and they're like, what? I don't understand any of that. So really I always feel like I create a good bond with them, and they really do trust me. Sometimes I have to take a step back and put it in their language, making sure they really understand what's going on, what we want to move forward, how to move forward with the family, just making it very clear cut. And I've been working on that, kind of looking up some YouTube videos and just articles and how to better my communication, and even practicing with my friends that I live with now.
Great. Yeah, you're being really proactive about that, and that's a difficulty for PTs across the board, whatever they're working with. So especially with those kids, once you start working here, you're going to hear yourself speaking in children's language all the time. You're going to have to catch yourself for being professional, but we're all on the same boat with that. Tell me a little bit more about your goals. What do you want to get out of this job? What do you want to get out of living in Michigan? Where do you want to see yourself in a couple of years?
So professionally, like I said, I want to create my own practice, really making it a whole, like, holistic view from the OT, speech path, and us PTs as well. I kind of want to take maybe after a year or so of working in your clinic, if I'm fortunate enough to get this position, to really take this clinic and make it one large treatment practice. I want to be able to have patients come in, and the OTs, the speech path, and us have one relationship with the patient, all be on the same page, understand we all have fluent practices going on between the patient, and make the parents and the families really comfortable being they could talk to the OTs, and the OTs will understand what we're doing in the speech path, because we want to be able to treat patients as fast and efficiently as possible. So that was one of my goals professionally. Personally, within 3 to 5 years, I hope to settle down, have a nice apartment or a home, maybe get a little puppy, which would be awesome, be able to go hiking with. So those are my goals for the short term, kind of. Yeah.
That sounds great. What kind of dogs do you like?
I had a golden retriever growing up, so maybe
too.
a golden doodle, just because they don't shed. That would be nice.
There's so much work with That sounds so great. It seems like work and then home life, you're going to try to get that really great balance there. Perfect. So I feel like I've gotten to know you very well. I feel very comfortable with you. Do you have any questions for me about the clinic, myself, anything pediatric related?
So in regards to a peds clinic, what age do we technically, I wouldn't say cut off, but when do we, what are your ages from infancy to when do we treat?
So here at Mary Free Bed, we take patients from infancy through 18 years old. Technically, when they become an adult, we help transition them to a more focused orthopedic, neurologic, any type of clinic that they need to go to specifically for that. And we have a lot of connections here to assure that the transition is seamless, that they are comfortable. They've been working with us for quite a while. So we work with the therapist that they will be with in the future, and we go and we will attend some of those sessions to make sure that our patient is as comfortable as possible with the transition.
Okay, yeah, that was another one of my questions. How close a relationship do you have with the other doctors on your hospital campus?
Very close. Our patients are not just patients. They are our little family here in the hospital. So we all take a role and take a great deal of responsibility in their health. I'll pass a doctor in the hallway and we'll chat about our patients, how they're doing, how they felt that day, if they were happy, if they were sad, if they watched a great TV show, how their therapy is progressing. We are with them the entire time, holding their hand, and then when it's time to let them go, we wave them on and we'll check in with them periodically with their lifelong relationships that we form.
That's great to hear, because sometimes, that doesn't always happen. One of my previous clinicals that we had, the relationship between the neurologists and the orthopedics and the PTs, it wasn't that it wasn't great, it just wasn't strong. And I feel like there, again, created a little bit of confusion for the patient and the family.
Yeah. We try to be on the same page as much as possible.
That's great to hear. In regards to pay, through my research, the national average is about $72,000. What is your pay for an average physical therapist?
So starting out, we typically start you around 70.
Okay.
We have a benefits package that our HR person will go over with you.
Okay.
And it takes care of my family, our benefits, so I'm very pleased with.
Okay, that sounds great. If that sounds okay if I could maybe talk to your HR person, maybe just to discuss that a little bit
Mhm.
more in the future, if that sounds okay with you.
Certainly.
Okay, sounds good. My last question is in regards to after treatment or once a patient gets discharged, how do you keep a close connection with not only the patients but the families? Because, again, peds, it's really important to keep their treatment process really strong, not only in the clinic but outside the clinic. And what techniques do you use to really make sure that the patient and the family are participating in treatment outside the clinic?
Before our patient is discharged and throughout their entire treatment, we make sure that their family is involved in their treatment. They know how to aid the patient in their home exercises, their home life, and we don't send our patients off and say, see you later. We have little graduation events. So we host all these different types of holiday parties or seasonal events, and we invite our graduates in to come see what our patients are doing, see how far they've come, and it's so rewarding for us to maintain that relationship. 2 months ago, I went to the wedding of one of my former patients. Yeah,
that's
so
awesome.
we do try to stay as close as possible to our patients while still letting them go out and explore life themselves.
Oh, awesome. Well, that's really all I had today, and you and your practice has really solidified that the patient comes first, which I've always taken pride in, and making sure that they have a lifelong of not only happiness but health happiness as well.
Yes, certainly.
Yeah.
That's our goal.
Yeah.
Put the kiddos first. Well, Corey, it's been great meeting
Thank
you.
you. Nice meeting
You'll
you.
get an email and a phone call from us. We'll let you know the status of your application, your interview, and we'll call you back for sure.
Okay, I think you have my number.
I do, right on your interview.
Great. Thank you so much for meeting.